The Governing Council of AIOS and Chairman Scientific Committee, Sir Mr. Madam, for the opportunity. I have this topic, decreasing the risk of ARMD, role of diet and vitamins. I believe all of us are prescribing the macular vitamins to the patients in the OPD. All of us are getting questions regarding the decrease in the risk of progression of ARMD, and it's not specific to a retina specialist only. That's why this topic is chosen. So in the pathogenesis, we all know that oxidative stress, inflammation and angiogenesis, and more particularly oxidative stress, that plays a role in the dysfunction of the RPE photoreceptors, and this causes the disease. And regarding this table, we all are familiar with this. Many of our teachers are there, and all of us have been asked this question during our residency journey. So ARDS age-related eye disease study 1 formula was having vitamin C 500 and E 400 international unit, beta carotene 15, copper 2 and zinc 80. And in ARDS 2 they have added lutein and zeaxanthin 10 and 2 respectively to this, and beta carotene they have removed. Why I am showing this? Because ARDS 2 formulation, after 6 years of taking this formulation, there was a risk reduction of up to 26% in the people, those who have taken this. So this is very important slide from this talk, if anyone wants to take. Actually ARDS formulation benefits people having intermediate or late ARMD only. That means those patients who are not having ARMD or early AMD are not going to be benefited from this ARDS formulation. So that so far as the risk of progression to blinding ARMD is concerned. Now coming individually, vitamin C and E humans cannot synthesize. That's why we need to give it from outside, and especially the antioxidant property is helpful in this. Remember the previous 2 slides I was telling about the oxidative stress that is playing a role in the photoreceptor damage. Now coming to the lutein and zeaxanthin, the carotenoids. We all know the carotenoids. So green leafy vegetables. What are the green leafy vegetables? Is it the traditional green leafy we are telling? May not be. It is what I searched and I got this broccoli, lettuce, spinach and pumpkin, yellow capsicum and eggs. One non-veg in this. So there are different studies as I have outlined over here. All of them, they have proved that there is a risk reduction in the progression of ARMD with this carotenoids, with taking the carotenoids. Coming to lutein helps in increasing the macular pigment density, and ARDS with lutein and zeaxanthin had a reduction of 26% risk of progression to advanced ARMD. And coming to the polyunsaturated fatty acid, docosahexaenoic acid and icosapentaenoic acid are the 2 that were studied, and including Blue Mountain eye study, they have found that there is decreased risk of progression to ARMD related vision loss if we are taking these things. And seafood, fruits and nuts. Again, this is very important. See, fish is good. Like, I'm sorry, I have no differentiation about the veg, non-veg quality, but the fishes which are rich in omega-3 fatty acid are mackerel, salmon, fish, herring, tuna and sardine. So here probably we need to find out whether rohu and katla are coming. These are not there in the list when I saw. So we have to see for these fishes. Coming to copper was added to supplement formula containing zinc to reduce the risk of copper deficiency anemia. That we must know, because people who are taking zinc, they are more prone for copper deficiency anemia. Coming to zinc, it helps in the regeneration of rhodopsin and phototransduction cascade, and 80 milligram of zinc was found effective in comparison to placebo. Again, this slide, I want to just spend maybe 20 seconds in this. Please remember, this is a Mediterranean diet pyramid, and at the bottom, can you see daily activity we should do, and this food, like we should physically be active, enjoy meals with others. That is very, very important. You know, more than the food habit, it is the social gathering that they have given more importance. Then daily what should we should take fruits, vegetables, grain, olive oil, nuts, legumes, seeds, and a few times per week if you see the fishes and seafood. Weekly, maybe something like poultry or you know, the cheese, and monthly in small amount the red meat, and wine is also there over here. Okay, and the big the box you can see over is drink plenty of water. So if you want to remember anything, you know, this is the Mediterranean diet. And if you see a traditional ODI diet, that is, this is the traditional ODI diet. You know, weekly sometimes we take, not now. Nowadays the conferences are more, we get more food. But if you see the traditional, what at least I used to take in village when I was.
Time is up.
Yeah. So this is the last but one slide. These are the commercially available tablets. If I have no financial interest, the upper two are available in USA, and the lower ones, if you take in BD dosing, that is exactly fitting to the ARDS2 formulation. To summarize, intermediate or advanced ARMD patients should be advised for ARDS based supplements, and they have a favorable safety profile. There is less concern on the prevention of ARMD, and adherence to a Mediterranean diet should be encouraged. Thank you.
Thank you, Dr. Chitta.
I'm not sure we want to remember that diet list at all.
So the basic question is, to what extent do you think that so-called vitamins, macular vitamins in
Yeah,
OPD
exactly.
reduce the risk of AMD?
Yeah, so if we take it for, according to the ARDS2 study, if we take it for 6 years daily, then there is a risk of 26%. More fine, that's